Major innovations in total joint replacement surgeries are resulting in faster recoveries and better outcomes for patients.
On today's Health Talk, two highly regarded orthopedic surgeons will share with us their perspectives on recent advances in surgical techniques, prosthetic joint design, pain management, rehabilitation, and more.
So join us for a great show. We're up next. Hello, I'm Dr. Eric Mazur.
And I'm Dr. Andrea Peterson. Today we're going to talk about recent advances in total joint replacement surgery.
And our guests are Dr. Nicholas Polifroni and Dr. Mark Fletcher. Dr. Polifroni is Chief of Orthopedics at Norwalk Hospital, and Dr. Fletcher is a Norwalk Hospital orthopedic surgeon. Welcome back, both of you.
Thank you.
So great to have you here.
Thank you.
Now, I'm sort of amazed at how joint surgery has changed in the past 10 years or so. Maybe you can say it seems totally different. Patients are doing so much better. Maybe you could tell us some of the amazing things that have happened. Start with Nick, because you helped design the program, I know, at Norwalk.
Well, we've figured a lot of things out. A lot of joint replacements have been done over the years, but the whole system of the joint replacement was never in place. There have been a few other large universities that have established joint centers, but around 5 or 6 years ago, we decided to be one of those. And we hired a consulting firm to allow us to develop that here at Norwalk Hospital.
Mark, what's the benefit of having a whole joint center?
Well, it's just drilling down and becoming efficient with every process, as opposed to having hundreds of people going through a unique set. You make it into a very set pathway. You learn from things in the past, and you improve, and you have a kind of a framework with which to improve. And so you just sort of find best practices.
It sounds almost like the business is going better, but this really impacts the patients in amazing ways. I thought of joint replacement surgery and weeks of pain and long stretched out rehabilitation, and it's not like that anymore.
Well, we've changed a lot of our protocols. One of them is pain management, which is probably the most important one. We've eliminated a lot of use of narcotics. We use smaller incisions. We use different anesthetic techniques. They all result in less pain and an easier pain management. And probably one of the biggest things is educating the patients, preparing them for what they're going to experience.
So patients actually have a formal education program before their joints are replaced?
Yeah.
Yes.
There's a formal session that's done with the joint director in the hospital, and all the pre-op patients go in, and it's a couple hours of just going through the whole process and getting questions answered, and just having them kind of know what's in front of them as opposed to being surprised.
And it sounds like that's really made a difference both for patients and probably for their treating physicians as well.
Absolutely. They become very knowledgeable, and they're if they have questions, they're pointed questions as opposed to the fear of the unknown.
We've empowered the patient to be their own advocate, which is really great.
So what are the things now, the specific things you've done differently that have had big impact on patients? You've been in pain control. That's a major one.
We eliminated intravenous narcotics, which wipes patients out. So we don't do that anymore. We give small doses of a lot of different medications. It's called multimodal pain management. This is not just us. This is all over the nation. Joint centers are doing this.
Are you using more anesthetic in the joint space itself as well to take care of some of the immediate post-op pain?
There's so many different pathways pain can travel on, and so you use medications specific to each pathway, with nerves or substances, and so all those medications that are in the body being taken orally or intravenously is one part of it. The anesthesia, a spinal anesthetic, which is kind of like the doctor numbing your nerves for a dentist, and just making the nerves not work anymore for a short period of time, and then also injections in the joint itself. So many levels.
So when patients wake up from their operation, they're not the first thing they don't go is ah.
No, they have no pain.
No pain.
Wow,
no pain when
that's
they're
amazing.
And usually no pain.
Yeah, and when the therapist comes see them several hours after surgery, because we expect people to get up all day long. I mean, they'd say, okay, Mr. and Mrs. Smith, you need to stand up, and they say, okay, I'll try, because there's no pain.
For both hip and knee? Yeah. You're getting people up out of bed the same day?
Same day.
I was going to say, I mean, that in and of itself to me is remarkable.
Yeah. That's one of our goals. 100% of our patients the same day out of bed, and even walking in the hall.
Oh, I'm sorry.
Yeah, and why is that good for people? I mean, it's obviously, for so many reasons, but maybe I'd like you to say it.
Well, just getting people moving, it just drops, it makes them feel better. If they move early, they will move better, and they will progress faster, but in terms of just avoiding complications and risk of
Yeah, I
surgery.
think the risk of pneumonia and blood clots and things like
Yeah.
that would be much reduced if you get the patient.
Absolutely.
But they're doing that in all fields of medicine
Yeah.
now. Even ICU patients, they're starting
Yes,
to get them
it's
up.
remarkable, and it's fantastic.
Yeah, I mean, what we all thought that bed rest is good to heal you, it turns out it's not.
No.
It's really amazing how bad bed rest is for you.
And people lie in bed, they feel sick. These are not sick people. These people have just had a surgery. So you want them to say, okay, I've had a surgery, but I feel well, and
That's a
I want to
great
get up
point.
and move.
And most people are having it to improve their
Right.
functionality, so get that going.
So the surgery itself is different in you said smaller incisions. How about the prosthetics you use? Are they different, Mark?
They've been the modern total joint is about 60 years old, and so there's been several iterations and renovations. So every time they come out with new prosthetics, they've become more shaped to different people through a range, and they've become much tougher. I think the biggest, along with kind of how they've changed slightly over time to become more and more specific to a person, they've become much tougher in the last 10 years. We've increased their ability to withstand wear and survive in the body by about an order of magnitude, which is a 95% improvement in terms of wear.
Wow. So Nick,
So-
it almost sounds like we're making these surgeries more personalized in a way for particular
There are
patients.
personalized surgeries now. There are custom total knees being done, which the total knee is actually ordered for the patient
Wow.
based upon a CT scan. But another innovation is the instrumentation, so it allows us to use smaller incisions because the instruments are designed for accuracy through smaller incisions.
Now, as an orthopedic surgeon, does that disappoint you? Because I remember orthopedics with big hammers and nails and saws, and that's why I didn't go into orthopedics. But
We
I mean,
still have
now
them.
you guys
We
are
still
doing
have
delicate
those.
surgery.
Yeah. No, we still haven't, but
I'm being facetious.
Yeah,
of
right.
course.
I know.
But it's it's still a very satisfying surgery to do, and then if you can do it in a way and you're still delivering the same kind of the implant and taking care of the arthritis, but someone doesn't have to stay in the hospital, stay in bed for days and days and days, you feel a lot better about it.
And just to mention some of the benefits of smaller incisions, I mean, it sounds obvious that smaller would be better, but it sounds like maybe you can tell us, Nick. With
Well, we've
healing.
gone through a whole gamut of trying to get really, really small, and eventually we got to a point where you could having trouble doing the surgery. So small doesn't really make any difference anymore. You can make an incision that's 2 inches longer, and it's what you do down deep inside the tissue that's really the most important.
So you're
And-
disrupting less normal tissue.
Right,
and-
Yeah.
exactly. The instruments are easier to use, so there's less distraction, there's less trauma to the soft tissue, less injury to the
Maybe we
soft
can say
tissue.
something about CT scanning and three-dimensional reconstruction of the images allow you to really precisely plan the surgery, and then there are even robots that help you
Yes.
cut angles and slice things the right way, and maybe I could even do it with the robot helping me.
Maybe you could.
No, but go tell us more about it, because it just seems so personalized and so specific for the patient now.
Well, we've been, in this kind of evolution of joint replacements, we have all this technology. It's essentially building a space shuttle in the shape of a total knee in terms of the energy and the effort and all this stuff that's gone into the material sciences. But we're still using manual instruments to align them. Now, they're excellent, and they're very precise, but using computers, modeling the actual patient's anatomy, and using computers to help us deliver the implant has just made our ability to be precise every time much better. So it's really taken our standard deviation. It's the range of normal we can put in. If it's a 5-degree swing, now we can get it down to 1
Which is,
or 2.
Wonderful.
So it's just more precision.
and if you said something before the show that patients are going home after 2 days.
Well, our length of stay, our joint care coordinator just announced our length of stay is now under 2 days, which means the average person is going home in less than 2 days. Some are
Yeah.
going home the morning after surgery,
Yeah.
which I think is fine. I think that's, and they're ready for it.
Hey,
It's
I was
not
just
like
going to say,
we're-
you're
we're
not pushing them out the door.
No, it's not a slide out the window. They are ready to go, and they
That's-
compete with each other because they're prepared for it.
That's amazing.
Revolutionary and wonderful.
Yeah.
That's about all time we have for this segment, but thank you so much for all that wonderful updates.
I want to thank our guests, Dr. Nicholas Polifroni and Dr. Mark Fletcher, for joining us on Health Talk.
Please send us your questions and comments at healthtalk@wchn.org.
Thanks for watching, and be well.